ovarian cancer, quite a high yield topic for the USMLE. So epithelial ovarian cancer can present as shortness of breath, so that can compress the lungs, and can present as obstipation, constipation with vomiting and abdominal distension. Over here, we can have over here pelvic abdominal pain, bloating, early satiety, and we can see adnexal mass. As we spoke about in our previous adnexal masses video, we can have an increase in its carcino embryonic antigen 125. Ultrasound findings solid mass, thick septations, ascites, and we can see exploratory laparotomy. Guys, I wanted to speak about over here, I've written on the side like factors that can increase the risk of ovarian cancer. That's like Lynch syndrome, age, BRCA1, BRCA2, endometriosis, because endometrium can deposit on the ovary, that much ovary that can lead to cancer. Nulliparity, because we are always doing ovulation, so nulliparity there. But what is a protective factor? Protective factor is me OCPs. They decrease ovulation. Tubular ligation, again, those cut off ovulation signaling towards ovaries. Next is going to be breastfeeding. Breastfeeding more prolactin decreases the amount of cycle and decreases the amount of usage ovulation of the ovary. And we also have breastfeeding and previous pregnancy. Again, you're going to have decreased ovulation. So anything that decreases ovulation decreases the chance of ovarian cancer. So we can see over here epithelial ovarian cancer refers to a malignancy involving the fallopian tube and peritoneum. We can see histological abnormalities can begin at any time the sites present with hallmark or large ovarian mass and widespread pelvic and abdominal metastasis regardless of primary origin. I just want to mention some questions. So I got over here, this is a CMS question. So 65, I'll just hide it over here. 65-year-old female with 2 second coccygeae, and the right ovary is palpable but not the left. What is the most concerning over here? So she has a cystocele, and she has a palpable ovary. What's more concerning? In elderly female, it's a palpable ovary. We don't want to see any palpable ovary. Cystocele, it's normal in older females. Here's another question over here. A 25-year-old female, left lower quadrant pain. What is the best recommendation for ovarian cancer prevention? As you spoke about, decreased ovulation. So take OCP no further. Okay. Let's come into these other types of ovarian cancer over here. We're going to speak about Satori lytic. This is going to be Satori lytic, gives me sex cord, and this may increase amount of testosterone. So guys, with testosterone, increase of realization, you want to remember 4 things, okay? I learned as CMIN. So C is citromegaly. And the M over here is going to be increase, like male pattern baldness. So like something that I'm kind of experiencing right now. I is going to increase muscle mass, and N is going to be nodulocystic acne. So these are the 4 characteristics you want to do. We also mentioned voice over here, but other things we mentioned. Oligomenorrhea, very important because we messed up the FSH, LH, and we kind of messed this all up over here. So we can have oligomenorrhea and unilateral over here. And then, so because we have increased amount of testosterone, so decrease LH, FSH, so we're going to be getting a lot of oligomenorrhea over here. Okay. You can see surgery. Okay, then we can granulosa cell tumors, mean sex cord tumor, more estrogen and inhibin. So this is going to be over here a complex ovarian cyst mass. So in young people, it's going to cause precocious puberty, and elderly, we're going to have breast tenderness, abnormal uterine bleeding, and postmenopausal bleeding. We can have caught excimer bodies on histology, not that important. We can do a biopsy, and we can do surgery over here. So that's more or less it for this page. I want to just recap over here the 3 main ovarian tumors. One is epithelial tumor. So epithelial tumor is going to be any sort of, we can imagine like shortness of breath, constipation, obstipation, and it's going to have CA125 and ultrasound findings. Do not do any sort of biopsy, just go for a surgery and give some cisplatin, carboplatin. And then we also will have the granulosa cell tumor, which is basically going to be bleeding. So that's going to be precocious puberty in young people, or postmenopausal abnormal uterine bleeding and breast tenderness. And we have Satori lytic, which we spoke about, male pattern baldness. It can lead to muscle strength, it can lead to acne, it can lead to voiceness, and it can lead to citromegaly as well. Just a few, I have 2 questions. I just have this 2 questions over here. So we can see over here the reason why we're getting oligomenorrhea over here is going to be testosterone inhibits GnRH, decrease FSH, LH, and that's going to be leading to low amount of estrogen over here. So we are not proliferating the endometrium, so we want to have progesterone. We're not going to be doing any sort of proliferation as per se. What is the diagnosis in a young girl with breast development, white odorless vaginal discharge, with an ovarian mass ultrasound. So we just spoke about this. This is not sartorial, it's going to be granulosa cell tumor. And I have another question over here. A 7-year-old female with a 7x6 mass in the left ovarian mass. What's the next best step? Do not do fine needle aspiration. Do left oophorectomy. We can see if it's some wide odorless mass, we're going to be seeing estrogen. Estrogen is stimulating that. And estrogen stimulates the cervix and the vagina to produce mucus. We have another question over here. 28-year-old female with PCOS. She has worsening acne and facial hair. She has PCOS, and now she has a coarse hair on the chin and the upper lip, and she has bitemporal hair thinning. What's the diagnosis? So this is going to be definitely some sort of tumor, which is going to be sartorial over here. So guys, keep that in your mind. I hope you found this very useful. I hope to see you guys next time.